Well, thank you very, very much. To say that this is a very special and very humbling moment would be the obvious understatement. Thank you for that very kind introduction. Thank you for the selection committee and the board and the staff and everybody who's made this event possible. This is really a very special moment. I want to thank and congratulate Glenn and other past recipients. It's certainly an honor to stand next to them. I thought it was particularly appropriate that Christy said that tonight we were, I think it was Christy, maybe Irene, that could be the first fumble of the evening. One of these fine women said that we're celebrating leaders and leadership. And I think that's most appropriate because this field is blessed with terrific individuals exerting great leadership at challenging times, which is exactly what this country both needs and deserves. So I want to take this opportunity to thank all of you as well for the leadership that you provide every day to make this healthcare system better. And I'm happy to accept this year's award on behalf of the field. The award, the recognition, it's all very wonderful and humbling, but to have your name connected with Gail Warden's is really special. Gail, thank you for your leadership, your friendship, your support. Been a great mentor to me. Thank you. I don't know if many of you know this, but Gail broke an important barrier, one that doesn't get written a lot about, probably deservedly. But he was the first former AHA staff member to become chairman of the board, which I thought was cool because he made it possible for me to do it about a dozen years later. So we have a special friendship and a lot of connections over our careers. I want to thank so many great friends and colleagues with whom I've had the opportunity to work, but most importantly, from whom I've had the opportunity to learn. I've had a very blessed career, many great relationships, many great people from whom I learned a lot. Started with George Allen at Haney's, Alex McMahon and Gail at the AHA. Many of you may not know that at one time the Blue Cross Association and the AHA were both at 840 North Lakeshore Drive here in Chicago. So I got to know and learn some from Walt McNerney. Certainly the Sisters of Providence out in the Northwest, who gave me the opportunity to serve for over a dozen years. People who I've met and worked with along the way, including, again, under Gail's leadership, the staff and volunteers at Group Health, where as a volunteer myself and a beneficiary, I learned a lot about integrated healthcare. And I've had the chance to learn from all of the AHA elected leaders, from Wade Mounts in 1975 up to our current officers, Jim Hinton, John Perlin, Jim Skogsberg, and many others from that elected leadership who have mentored me along the way, and some of whom are here tonight. I've had a great front row seat, many seats from which to learn from people who had leadership in action, and I guess it's kind of shame on you if you don't take that opportunity, right? So I was very blessed to have that opportunity, and would have been a very different career if I had not met these individuals. I've also had some darn good luck. Haney's was the only job I was offered coming out of grad school. Smart as I was, I took it. But actually, it was very lucky because I have an undergraduate degree in politics and a master's in health administration, and a trade association is perfect. Who would have thunk? But also, best of all, about 4 months in at Haney's, I met a nurse from the Joint Commission, Barb. Love you. My resume improved immediately. Barb is a nurse by background and has been a terrific lifelong partner and a personal clinical consultant to those administrators who don't know anything about patient care. So thanks, honey. I love you. Well, to the extent that leadership is having a vision and pursuing that vision while confronting the realities along the way, what's it look like over this period of time leading the AHA from the management side? Well, I went back and took a quick look at that first address, 2006, back at the AHA annual meeting, and a few things stand out. I talked about something old-fashioned. You don't hear much about this anymore. Anybody remember the common good? I haven't heard that in the current campaign, although I'm sure somebody's getting ready to talk about it. The need for hospitals and communities to take care of each other, and the need to provide coverage to all and spread the costs equitably across all of society. Thought we need to do even more. AHA's always done a great job of educating our legislators on the importance of hospitals, but we had to add to that a clear effort to improve our public credibility by getting rid of our vulnerabilities, especially those that affect patients directly in quality and safety. And I suggested that the effectiveness of our leadership lies in the choices we will help the American community make and in the vision of the common good that we put forth. And suggested it was going to take a handful of things. That we ought to incent and reward greater collaboration among providers. That we had to commit to absolute quality and safety for patients. We had to pull change to us so that we demonstrated leadership so that the public would have hope for a better health system and, again, improve our own credibility. We had to foster demand for change among the American voters by putting forth credible choices and showing them how it could be better. And lastly, we had to step up our efforts as citizen leaders ourselves, because I was worried about the demise, frankly, or as a friend once put it, the change that's happened in this country since we stopped being citizens and only became taxpayers. I think we're seeing some of the problems that that mentality has brought forth over this last decade or so. So if that was a starting point, I think you've heard some of the things, very kind to have my name associated with some of the things that we've been able to do in improving quality through the HEN Project and other efforts, through certainly the Affordable Care Act, the expansion of coverage, the reform that is bringing to us, other efforts around improving communications with the public, with our members, certainly the efforts of the AHA PAC and the Coalition to Protect America's Healthcare to keep those messages in front of legislators during a very raucous time on Capitol Hill and in the public media. All in all, I think that a lot has been accomplished, but obviously we have a lot more to do. So I'd like to just conclude by suggesting a few things. I think some of them you've heard about today, many of them. Maybe put them forward, although I loved our opening speaker, Stephen Lewis. I'll see if I can't channel some of his passion. But as I finish this full-time involvement, I see a future that's both bright but requiring strong leadership. Yes, it's summed up by the triple aim, but let me try to put a few specifics to it. First of all, I see a cost challenge, clearly a cost challenge, and we're very proud that we've been able to lower the annual rate of increase. But frankly, that only means we're getting more unaffordable more slowly. We are not dropping the absolute cost for the American public. Now, yesterday and days past, somebody might be willing, maybe only the healthcare consumer was willing to lend their checkbook and let somebody else write the checks. Not anymore. They're not going to do it. And we're seeing it this time around with coverage, people picking high deductible plans that they've come to realize they can't afford to use because they can't cover the deductible. So the cost challenge is a real one. I think I don't want to dismiss the low rate of annual increase. I think that's an enormous accomplishment, a long way from where we were a decade or so ago. But in the coming decade, we have a challenge to figure out how to make ourselves much more affordable for the American public. And that's going to take a lot of effort on everybody's part in healthcare. Secondly, I learned in one of the very first meetings I went to as AHA president, I learned something from Dave Lawrence, who was then the retired chair of Kaiser Permanente. And David put it eloquently. He said, "We must learn to reserve the physician's skills for the point of clinical ambiguity." We've got to get them off the treadmill of payment and of doing things. And we've got to raise the ability of all other health professionals to do what they're capable of doing. Possibly better, and I would think certainly less expensively. And it would be more satisfying for both the physician and others. So we have to retool the way we do our work, the way we provide care. And frankly, back to our keynoters' comments, that's not only going to take some changes in scope of practice and licensure issues, but it's going to take real teamwork and a real sense of equity between the traditionally, although less and less so, male physician field and the traditionally, although less so, female world of nursing. So I think when we get that team really working together, we can bring about great change. Third, in order to accomplish, maybe I got these out of order, but in order to accomplish that reduction of cost, we as hospitals have to fall out of love with our overhead. I don't know how else to put it. My career has been one of building. All of us have built this system. We're proud of it. We're proud of the physical structures. We're proud of the networks and the systems and everything else. Now it's going to be done much less expensively, much more electronically, and much more distributed. So less emphasis on overhead. We can't afford to make 20 and 30-year bets on capital investments anymore, in my opinion. So I think that's going to need real leadership. And lastly, and most importantly, we have to achieve high reliability for all. I salute many of our state hospital associations that have gotten 100% participation from their members to commit to high reliability, getting it right every single time for every patient, and making sure that every patient, to the diversity and equity theme that's so important, gets the care that they need, that they deserve, and that will provide the best result. So I know it sounds a lot like the triple aim, which is probably not a bad summation, but I think there's a sense of urgency, and frankly, I think we need to amp up some of the triple aim, including that notion that it's not just better healthcare, it's actually highly reliable healthcare. Not that it's just reducing costs, but reducing costs to a level of affordability. And of course, theme of this meeting, collaborating to improve health at the community level. So the future is one where I know we talk a lot about disruptors. I'm old enough to remember when an HMO was a disruptor. Somebody told me not to go on the board of an HMO because the doctors I was working with wouldn't like that. And frankly, at the time, I was too scared not to take the advice. But over the years, I think we've seen how disruptors have actually become partners. So I would challenge us too to look at today's disruptors and see innovators and partners everywhere. So I'm actually very encouraged. I think we're closer to getting it right than ever before, and as Fawn was kind enough to say, and I always like to say, I am so grateful that we're getting better, faster, every day. I look forward to seeing tomorrow's leaders build on the successes and clean up some of the, I wasn't going to say messes, but clean up some of the things that need to be addressed from what my generation has done. And I'm very encouraged, but I also am realistic. I think in a lot of ways it's a huge lift, bigger lift than I was challenged with, and I believe that these challenges will require leaders to have skills, energy, and a time horizon better suited to them than to me. So thank you very much for this wonderful recognition, this opportunity to share a few thoughts, to say thank you, and not goodbye, but won't be seeing you as often. Let's just put it that way. That'll be my loss and our loss, but also I know that the field is in great hands. I know that the AHA is in great hands with Rick and the team, so it's a good time. Thank you very much.